Thank you for joining today's call. Your telephone line has been muted in order to eliminate background noises. At the conclusion of the presentation, all participants will have an opportunity to dialogue with the presenters. I would also like to remind participants that today's call is being recorded. Your host for today's conference is Mr. Bill West. Bill West is a compliance coordinator in the compliance branch at the Division of Practitioner Data Bank, Bureau of Health Professions, Health Resources and Service Administration, U.S. Department of Health and Human Services. The Division of Practitioner Data Banks is responsible for the management of the National Practitioner Data Bank and Healthcare Integrity and Protection Data Bank. As a compliance coordinator, Mr. West is part of the team involved with initiatives related to compliance monitoring and technical assistance for the division. Thank you, Mr. West. You may begin.
Thanks very much, Heather. Good morning, everybody, or good afternoon, depending on where you're joining us from. This webinar session will provide an overview of the data bank and our upcoming compliance activities with behavioral health licensing and certification authorities. Thanks so much for joining us today. I want to mention that we will have a question and answer session following the slide presentation, and also that the webinar will be available to you, posted on our website following the session. Also, following today's presentation, we'd be happy to be in touch with you to answer any additional or follow-up questions that you may have. Here's an overview of our talk today. The reason we invited you to participate in this webinar today is because we are beginning a compliance process with state licensing and certification authorities for behavioral health. Before we get further into the slides, I'm going to spend a few minutes providing a backdrop for our presentation today. The efforts we are undertaking began last year when our parent agencies, the U.S. Department of Health and Human Services and the Health Resources and Service Administration, HRSA, undertook efforts to improve the completeness and accuracy of data reported to the Healthcare Integrity and Protection Data Bank, or HIPDB, and the National Practitioner Data Bank, or NPDB, collectively called the Data Bank. The Secretary of Health and Human Services exercised her legal authority, as defined under the Social Security Act, to publish a report listing the state agencies that failed to meet their reporting requirements to the Data Bank. In brief, the federal statutes require state licensing authorities to submit within 30 days adverse licensing and certification actions, as well as negative actions and findings taken against healthcare entities, healthcare providers, suppliers, and practitioners. These reportable actions or findings include both final action and those taken as a result of formal proceedings. So as we continue today, we will touch briefly on the laws that impact the reporting process for adverse licensure actions or disciplinary actions, and then we will talk about the disciplinary actions that need to be reported to the data bank by licensing and certification authorities and boards. Then we will focus on the compliance activities that we will be working on with each of you over the next several months. We'll talk about data collection and data comparison and reconciliation and statuses and web posting and so forth. Before we get into that part of it, a few words about us. The Division of Practitioner Data Banks, or simply the Data Bank, is part of the Bureau of Health Professions. The Bureau of Health Professions is one of 6 bureaus and 9 offices that make up the Health Resources and Services Administration, or HRSA. HRSA comes under the umbrella of the Department of Health and Human Services. HRSA is the primary federal agency for improving access to health care services for people who are uninsured, isolated, or medically vulnerable. And we also provide leadership and financial support. The mission of the Bureau of Health Professions is to increase our population's access to health care by providing national leadership in the development, distribution, and retention of a diverse, culturally competent health workforce that can adapt to the population's changing health care needs and provide the highest quality of care for all. The Division of Practitioner Data Banks, or just Data Bank, as part of HRSA's Bureau of Health Professions, is committed to the development and operation of a cost-effective and efficient systems that offer accurate, reliable, and timely information on practitioners, providers, and suppliers to credentialing, privileging, and government and state authorities like all of you. So we're going to spend a few minutes talking about legislative authorities. We'll spend a couple minutes on this slide. And to remind us all again, today's presentation will focus on the compliance activities that the data bank is starting up with state licensing authorities for behavioral health. Now here's a very brief summary of our authorizing legislation and the impact of recent legislative changes on our data bank reporting requirements. The data bank was established through the Healthcare Quality Improvement Act of 1986 to act as an information clearinghouse related to the competence and conduct of physicians, dentists, and other healthcare practitioners. With the implementation of Section 1921 of the Social Security Act in March of 2010, and with the enactment of healthcare reform, the National Practitioner Data Bank, the NPDB, was expanded to collect and disseminate adverse information beyond just the actions based on the professional competence and conduct of physicians and dentists. The intent of this new section, 1921, is to protect beneficiaries participating in the Social Security Act's healthcare programs like Medicare and Medicaid from unfit healthcare practitioners, and also to improve the anti-fraud provisions of these two important programs. With access to this expanded information, the potential to improve the safety of patients is definitely increased. So Section 1921 information is available to hospitals, other healthcare entities, and state licensing boards by the process of querying the data bank. This information benefits hospitals and other healthcare entities and state licensing boards with pre-employment screening as well as with credentialing. Human resource departments, HR departments, can now query the data bank to support their employment decision-making for all licensed healthcare practitioners. For example, physicians, nurses, physical therapists, pharmacists, chiropractors, podiatrists, and a variety of other health-related professions. But for these queryers to get accurate information to inform their decision-making, the information must be reported to the data bank timely and correctly. And although private accreditation organizations like the Joint Commission and the National Committee for Quality Assurance will begin reporting as a result of this new section of the law, it's state licensing agencies and authorities like you that are responsible by far for the bulk of the reporting to the data bank. The second piece I want to mention is about the Healthcare Integrity and Protection Data Bank. The HIPDB, as we call it, was established under the Social Security Act and attached to HIPAA, the Health Insurance Portability and Accountability Act of 1996, with the purpose of deterring fraud and abuse in the healthcare system. Federal and state agencies must report to the data bank, but with the implementation of that new section of the law, Section 1921, state licensing boards and authorities are submitting through one process to both the NPDB and the HIPDB without submitting separate reports. And last year, the Affordable Care Act included a provision for the NPDB and the HIPDB to be merged to improve the efficiency and reduce duplication. So the two databases will be merged this year, and this merge will have no impact whatsoever on reporting or querying and will not change how or what state licensing authorities or boards submit to the data bank. You may still have the question, do I have to report to both the NPDB and the HIPDB? Agencies that are required to report an action to both data banks only need to submit a single report, and the report will be stored in the appropriate data bank. Ultimately, you must determine how the data bank's reporting requirements match your board's actions. We know that data bank terminology and your state terminology may vary and occasionally cause confusion. And when you need help in this way, the data bank's compliance staff and help desk are available to you to assist you in understanding and navigating the reporting requirements. We'll spend a few minutes on this slide now talking some more about reporting to the data bank. So what are the reporting requirements? Let's take a closer look. The adverse licensure actions taken against all healthcare practitioners, marriage and family therapists, or professional counselors, for example, are reportable to the data bank. We realize that there is variation across states when it comes to the boards that regulate the behavioral health and substance abuse professions. So to clarify, if the practitioner, the provider, or the supplier is licensed, certified, or otherwise authorized by the state, then the state must report the action it takes against that license, certification, or authorization. Reportable licensure actions are defined in the NPDB statute, which is available on our website for you to read. So, this would include any formal or official adverse licensure action taken by a licensure authority or board, which may include certifications or other authority given to the state agency to regulate or govern the ability of the practitioner to practice their profession. This includes actions against healthcare entities, which are also reportable to the data bank. And people ask for examples of entities would be nursing homes, pharmacies, or home health agencies. Now, the top link on this slide is to reference our library on our website, and the bottom link takes you to a flow diagram and a decision tree to specifically assist state licensing authorities in the reporting process. You'll also find similar decision trees to guide organizations who report clinical privilege actions, medical malpractice payments, and criminal convictions and civil judgments. And there are lots of other resources for you to check out on this page as well. Here are some reporting specifics on the next two slides. So, adverse actions taken as a result of a formal proceeding, formal hearing, or formal or final board action are reportable to the data bank within 30 days. An action is reportable then when it's the result of a formal proceeding or a final action and includes one of the following four characteristics. Just make a note, there are 2 bullets on this slide and 2 on the next. So first, an adverse action, formal action, including revocation, suspension, reprimand, censure, or probation. Second, a dismissal or closure of a formal proceeding because the practitioner surrendered the license or left the jurisdiction. Or 3, any other loss of license or right to apply for, renew a license by operation of law, voluntary surrender, or non-renewal, excluding non-payment of fees, retirement, or inactive status. Or finally, 4, any publicly available negative action or finding, and this is to include a healthcare-related administrative fine or citation resulting from a formal proceeding. Now, before we move to the next section to talk about upcoming compliance activities with you, I want to touch briefly for you on who can access this reported information. The information contained in the data bank is not accessible to the general public. So who can view or query this information? Well, first, practitioners and entities may perform a self-query. That makes sense. Also, state licensing authorities or boards like you may query the data bank. Hospitals and other healthcare entities or agencies administering federal health care programs like Medicare and Medicaid and contractors to those programs, and also state agencies administering state health care programs, state Medicaid fraud units, the U.S. Attorney General, the U.S. Comptroller General, all may access information in the data bank. So, we, at this point, have covered the nuts and bolts of what you need to report and who may access this information. Now let's talk about our current and upcoming compliance activities with you. The adverse licensure action compliance activities to verify and correct missing data began with state licensure boards in February of 2010. There were 2 initial groupings. The first group is called the Never Reported Professions Compliance Effort. For this compliance effort, a list of current state agencies and licensing boards responsible for licensing or certifying healthcare professionals was compared to data reported to the data bank and to state licensing authorities that may not have reported any adverse actions, and these specific professions were identified. HRSA then contacted these agencies and determined the professions that were subject to the federal reporting requirements, and we worked with each of these licensing agencies to ensure that appropriate reporting started up. The second group, the Adverse Licensure Action Comparison Project, compared publicly available disciplinary licensure actions published on state websites for certain years with data currently stored in the HIPDB. HRSA contacted state licensing authorities with the results of this comparison and sent letters indicating which actions were not found in the data bank. And they requested agencies like you to review these actions and report actions as appropriate. Now, these projects were updated this past December, and the next update is scheduled for this coming July. To view the posted statuses, use the link at the top of this slide. Then follow the links under Compliance on our webpage and look for the Adverse Licensure Action Comparison Project. You'll see that the results are organized by state, and you can just click on your state to view all the posted results. Here's a quick summary of the project that you are now in the process of joining. The behavioral health licensing authorities will become part of the Adverse Licensure Action Comparison Project, and you are in good company. This comparison project started with 6 of the top queried professions you see listed here. This included social workers and psychologists. The project also included physicians and dentists, and most recently chiropractors, physical therapists, and optometrists. To date, we've made 587 comparisons for these 11 professions, comparisons of reports in the data bank to publicly available licensure action data. At this point in time, these boards are 98% compliant, so really great results to date. And we're still working with the remaining 2% to bring them into compliance. The behavioral health professions will be the 12th group that we are working with on this compliance activity. So welcome. This slide shows the professions that we will be looking at this go-around, which includes professional counselors, marriage and family therapists, mental health counselors, substance abuse counselors, and there is a fair amount of variation in professional titles for behavioral health. So at this point, most of you have received an email to verify the specific profession titles your state recognizes. This email also provided you with information about electronic report forwarding. This is a feature that became available this week on our website. Now we'll get into the specifics of our activities with you over the next several months, so you have an idea of and can put some order to the activities we'll be working on together. So by now we have verified the correct contact information at your organization for the behavioral health professions, and this is how you came to join us today on this webinar. We have, for the most part, confirmed with you what professions you recognize and regulate. Next, to make a comparison, we first need to obtain or capture some adverse licensure or disciplinary action data from you. So, data capture. Some of you who may not have data publicly available will hear or have already heard from us with information about how to exchange data with us by secure messaging. After we obtain data, we will look very closely to determine compliance with the federal reporting requirements, which we just reviewed on some earlier slides. We will then communicate back to you the results of this gap analysis and work with you individually to correct or otherwise reconcile the disciplinary actions that are in question. This step may also involve the exchange of secure messages with you, using your data bank login to log in to IQRS and exchange information with us securely. Now, for the purposes of this July compliance activity, this correction process will continue with your agency until we are able to assign a compliant status to you. So however long that may take, we will work back and forth with you until all the discrepancies have been resolved. As far as data capture goes, the review period that we're looking at will be from 2006 to 2009. We're in the process of obtaining data from your websites this month and part of next month. If the information is not publicly available or only partial data is available on your website, data will be requested by secure messaging. And that will happen, for the end of January and possibly the beginning of February. We hope to obtain all the data from you by early March. To the best of our ability, based on the available information sources, we will focus solely on reportable licensure actions. We are presently capturing data from your websites. Now, if you think there may be a problem with the data on your website or you think there is a better source for your data, please contact us and let us know as soon as possible so that our data will most accurately reflect your licensing board's activity. And as you will see, the more accurate the data, the easier the reconciliation process will be. For the current audit, all disciplinary actions, again, will be reviewed from January 2006 to December 2009. If you have received a request for data from us by secure message, this email would contain instructions, a letter from our director, Cindy Grubbs, a template to use for your data, and a 30-day time frame. Next, let's look at data analysis. Each disciplinary action is examined and compared against data bank reporting standards, which are based on our authorizing legislation, rules, and regulations. The questions we ask are, is the licensure action reportable to the data bank? Was the licensure action reported correctly? Actions that are reportable but not found in the data bank are flagged, summarized, and communicated back to the licensing authority as gap data. Licensing authorities are then asked to review the gap data and respond. If the actions in question are reportable, then we ask that you report those actions. If you believe the actions have been reported, then we ask that you provide us with the DCN, or the data bank control number. If you believe the action is not reportable, then we ask that you provide us with an acceptable justification for not reporting the action. And this reason may be based on information that you have that we don't know anything about, or there may be state laws or statutes or other state policies that are unknown to us that will explain why you have not reported the actions to the data bank. We realize that there is no common definition of the term other negative action or finding, and that in most cases, other negative actions and findings will be guided by state laws and statutes. Let's now look at report reconciliation and status assignment. A compliance coordinator at the Division of Practitioner Data Banks will be assigned to your agency. The coordinator, and by the way, it's a great group of folks that work here, will work with you one-on-one by email and by phone to assist you with reconciling any gap data that we identify. Our data bank help desk staff is also available to help you with the logistics of reporting and with registering with the data bank if you need assistance with that part. This process will continue until you have reconciled all the disciplinary actions in question. On June 15th, we will take a snapshot of your compliance status by looking at your progress up to that date. We will then map your progress to our business rules and assign a compliance status to your agency based on that point in time snapshot. So 15 days before our posting deadline, which is June 15th for our July 1st posting, we'll take a look at what has been resolved at that point and assign a compliance status to you. Now, if your agency does not meet the criteria for compliant by that cutoff, our compliance coordinators will continue to work with you to achieve the compliance status as soon as possible. So your status will fall into one of four categories. Now, for detailed information and definitions, you can follow the link that I've provided here. But compliant means that all report reconciliation has been completed. Working toward compliance means that some reporting has been started and verified, or that we have approved a corrective action plan for you to do so. Non-compliant means that no reporting has begun, or the agency has been basically pretty unresponsive to our attempts to communicate with them. I'm sure that won't be any of you. And then under review means that there are special issues or under consideration, or that your data or corrective action plan is still under review by us on our deadline, which is July 1st. So we have the bullet up there, corrective action plan. I wanted to just say a few words about corrective action plans. When we have identified and agreed on some actions that need to be reported to the data bank, we will ask you to agree to a plan, or rather a corrective action plan, or CAP, to do so. The corrective action plan specifies how many actions need to be reported, your time schedule for reporting these actions, the date completion is expected, and it contains also an attestation by you to continue reporting to the data bank in the future. The plan is usually sent to us or emailed to us, and your process of reporting to the data banks should begin 15 days after your plan is approved by us as an acceptable plan of action. So your audit status will be posted on the data bank website and available to the public on July 1st, 2012. And you'll find the statuses are organized by state and by profession. And you can look at the current status under this link. You click on the View Status of Comparison Project. These are the same links I gave you the screenshots of before. And of course, after the posting, if an error is found and we find that it's our fault, we'll of course immediately correct your posted status. We do have several levels of review on our end and checking and rechecking, but occasionally mistakes are made, and if such a thing happens, we'll be quick to correct that. Now, as I mentioned, there are resources available to you on an ongoing basis to assist you with questions, resources, or any concerns that you might have. If there's additional training you might need, or if you need help interpreting a policy, or any help navigating our website. We have a great team of people here in the Compliance Division that are ready to work with you to make this process move along as smoothly and as painlessly as possible. And we see this as a collaborative process, not as a punitive process or an adversarial process. So we look forward to working with many people that we have met through previous compliance activities, or to meeting you and working with you for the very first time. Our contact information is provided on the last two slides for you, so feel free to contact me by email or by phone with any questions or concerns that you might have. If you have any follow-up questions or concerns, or having trouble getting a hold of people or the resources you need, feel free to just give me a call, drop me a quick email, and we'll try to get things in order for you as quickly as possible. We know there are some new twists on this compliance process, some new things that we're trying, and we want them all to go well for you. So feel free to get a hold of me if you're having any difficulty, and we'll try to get that straightened out. We want to thank you for the time you spent with us today, and we hope we provided you with some good information, and we look forward to speaking with you and working with you through this audit in the days to come. And thanks very much, Heather.
Thank you for today's conference. You may disconnect at this time.